Committee Chair, Epidemiology and Disease Control Division, Director. Thank you. We're back. Ministry of Health and Population, Mr. Mahendra Prasad Shrestha, sir, to take the seat in the dais. I'll continue without the mic. I think I'll be hurt. At the dais. Finally, in the course of dais seating, I now request as the guest. Similarly, we have sent out invites to various departments within the Ministry of Health and Mantralaya Niti Yojana तथा अनुक्रममा सहायका निर्देशक ज्यू गर्दछु। त्यसैगरी स्वास्थ्य तथा जनसङ्ख्या मन्त्रालय गुणस्तर मापन तथा नियमन महाशाखाका प्रमुख तथा सञ्चार केन्द्रका प्रमुख तथा प्रतिनिधिज्यू, स्वास्थ्य सेवा विभाग उपचारात्मक महिला आयोगका प्रमुख तथा प्रतिनिधिज्यू, उपप्रधान एवं स्वास्थ्य तथा जनसङ्ख्या मन्त्रीका स्वास्थ्य सल्लाहकारज्यू, स्वास्थ्य निर्देशनालयज्यू, स्वास्थ्य मानसिक अस्पताल निर्देशकज्यू, नेपाल जनस्वास्थ्य परिषदका अध्यक्षज्यू, नीतिज्यूहरूलाई पुनः एकपटक स्वागत गर्दै यथास्थानमा आसन ग्रहण गरिदिनु होला र हाम्रो स्वागत स्वीकार गरिदिनु होला भन्ने हार्दिक अनुरोध गर्दछु। पत्रकार महानुभावहरूको उपस्थिति रहेको छ। We would like to welcome all the journalists and reporters present here. Thank you very much. We will now proceed to the national anthem. Please rise. We would like to apologize for the technical glitch and thank you very much for your understanding. The organizing member secretary and consultant psychiatrist at EDCD to provide the welcome speech with reflection on
mental health. This conference theme is mental health for all children and adolescents, and this conference envisions for improved mental health of children and adolescents through bringing together and engaging government, multilateral and bilateral organizations, health professionals, social workers, and private sector innovators, academics, and research institutions and civil society on the urgent attention and investment needed in child and adolescent mental health and their psychosocial well-being. The World Mental Health Organization has brought its 3-year slogan, especially focusing on child and adolescents, of Mental Health Day, focusing on mental well-being of youth and youth in the changing world. It is our collective initiative to address the issue highlighted by WHO from this low and middle income country Nepal to the international community and within the country itself. I would like to highlight 3 broad objectives of this conference. The first objective is to create a platform for government, multilateral and bilateral organizations, health professionals, social workers, private sector, innovators, academic and research institutions, civil society and right holders to exchange information, ideas, research findings, best practices on improving child and adolescent mental health. Second one is to present the best practices, experiences and cases for investing in mental health, exploration of like-minded national and international organizations, and use their good offices for furthering the objects of improving the mental health of all child and adolescents across the globe. Once again, I would like to heartily welcome you all in this important conference. Thank you for your valuable presence here. Thank you.
The conference chair and remaining dignitaries at the dais to support him in doing so. To deliver his address as the co-chair of the organizing committee.
Yes, Dr. Mahendra Prasad Shrestha, Coordination Division. Our guest from UNICEF, Tomu Ozubi, and all senior sirs who are in the front row, and all the respected delegates from all over the world, Nepal, welcome to the conference. When I got up today morning, I was going to write a speech. Then I thought, no, I don't need to write a speech. This conference is happening itself with a speech on its own. I'm so grateful and honored to be standing here. I almost feel like crying. I think it is a good beginning for children of Nepal, where we all come together, and I think we are all going to make a difference. And especially I have a sincere thank to Vivek Kumar sir with his effort and the ministry's effort that this has become a successful program. There is no need to say that till now we have very minimal services for child and youth in this country, but looking at this room today, I am really hopeful that it will not be a scenario in next coming years. I have a long presentation due right after the opening ceremony, so I'm not going to take a lot of your time. Like I said, all of you coming, participating, and everybody is government, non-government, NGOs. I think this is a good beginning, and thank you so much.
I would now like to request UNICEF country representative, Mr. Tomu Hozumi, to
Epidemiology and Disease Control Division, Dr. Vivek Kumar Dar. Mr. Mahendra Prasad Shrestha, Chief of Coordination Division at the Ministry of Health and Population, Dr. Arjun Raj Kumar of Kanti Children's Hospital, Mr. Madam Pradhan, Chair of C-Wing, respected international and national guests and participants, friends. On behalf of UNICEF, it is my great pleasure and honor to attend the opening ceremony of this conference. Globally, WHO estimates that 10 to 20% of children and adolescents experience some forms of mental disorders. This accounts for 15 to 30% of what we call disability-adjusted life years lost during the first 3 decades of life, which is a huge loss. Half of all mental illnesses begin by the age of 14 years and 3/4 by mid-20s. Neuropsychiatric conditions are the leading cause of disability in young people in all regions. If untreated, these conditions severely influence children's and adolescent development, their educational attainment, and their potential to live, to fulfill and lead productive lives. Children with mental disorders face major challenges with stigma, isolation, and discrimination, as well as lack of access to health care and educational facilities, which is a serious violation of their fundamental rights. Mental health is a major issue in Nepal as well. According to maternal mortality and morbidity study conducted in Nepal between 2008 and 2009, suicide was found to be the leading cause of death among women of reproductive age, accounting for 16% of deaths in this age group. It was also increased from 10% reported by similar study in 1998. As suicide is often wrongly categorized and also underreported in many countries due to taboo and stigma associated with it, the real situation can be even more serious. According to another study published by WHO Southeast Asia Region, WCLO, in 2017, the estimated suicide rate per 100,000 population for the age group of 15 to 29 years in Nepal is 25.8. This is the second highest rate among 10 countries of WCLO region listed in the same report. In terms of percentage of students aged 13 to 17 years who reported they seriously considered attempting suicide in the last 12 months, Nepal had the highest rate with 13.7%, compared with the regional average of 6.8%. In terms of percentage of students aged 13 to 17 years, again, who reported having been bullied on one or more days in the last 30 days prior to the survey, 51% of 51% of children or students in Nepal answered yes, which unfortunately is again highest in the region. These data indicate that there are substantial mental health issues among children, adolescents, and women in Nepal. Against this background, I'm very happy to see that this international conference on child and adolescent mental health is taking place in Nepal. I've gone through the program of the conference and was very much impressed with a wide range of mental health issues to be discussed in the next 2 days. I believe that this conference will serve as a great platform to raise awareness on the importance of this mental health issue in Nepal and also facilitate concerted efforts to address it. One point that may also be looked into in the course of this conference and future similar endeavors is exploration of the relationship between psychiatric side of children's mental health and neurological side of it in Nepal. Thanks to great development of technologies like functional MRI over the last decade, it has been becoming increasingly clear that maltreatment of children inflicts not only temporary psychological damage to their mind, but also more long-lasting and structural damage to their still developing brain and neural circuits. This is a phenomenon that lies at the crossroads of psychological and biological dimensions of child and adolescent mental health. Parts of children's brain that are known to be particularly prone to stress due to maltreatment includes hippocampus, amygdala, and frontal lobe. They are critical for human beings' functions like memorizing, thinking, emotion, sympathy, concentration, control, judgment, and learning. Technologies like MRI and voxel-based morphometry shows that physical size of these parts of brain of children who experienced maltreatment like corporal punishment are substantially smaller than those who have not undergone the same experiences. And this neurological damage to brain can very much lead to psychological problems as well, such as mood disorders, conduct disorders, sleep disorders, difficulty in concentration, irritability, depression, and dissociative disorders. Also, there are studies which show children who experience sexual maltreatment, particularly before 11 years of age, had shrunken visual cortex compared with those children who did not have such experiences. This negatively affects visual memory of the concerned children. It is surmised that brain of child victims of sexual maltreatment try to cope with traumatic experiences she or he has undergone by reducing the working memory of the brain. In other words, plasticity of children's brain could result to a negative coping strategy of not being able to see and remember the scenes that they do not want to by reducing the size of visual cortex. There are similar negative impact on children's brain structure caused by exposure to abusive languages, domestic violence between parents, and other types of maltreatment, which can lead to psychological and mental problems such as anxiety, lower IQ level, and attachment disorders. The scars created by these experiences are carried well into adulthood and the rest of their lives. In view of high incidence of child maltreatment globally and also here in Nepal, this is a very serious issue. A good news is that with proper care, children's brain can make substantial recovery even after exposure to this maltreatment, exactly because of its plasticity. Like any other public health issue, the first priority should be given to prevention of this maltreatment, as it is the best and most cost-effective strategy. But in case maltreatment has unfortunately already occurred, earliest detection and appropriate intervention will be extremely crucial to alleviate neurological damages to the brains of the concerned children and prevent psychosocial problems. The relationship between mind and brain is one of the cutting-edge issues in science. I hope evidence obtained based on solid research methodologies in this regard is utilized for practical actions and solutions efficiently and effectively in order to promote healthy development and mental welfare of children. I wish all the best for very fruitful deliberation in the course of the next 2 days. Thank you and
Thank you very much, sir. It has been a matter of gratitude for us to receive the guardianship of Ministry of Health and Population for this conference. And it's an even big honor to have received Mr. Mahendra Prasad Shrestha, the Director of Coordination Division, Ministry of Health and Population, as the chief guest for the ceremony. I now request Mahendra sir to give his address to the conference.
Thank you. Good morning and namaskar. Mental health is an integral part of the health. Indeed, there is no health without mental health. Respected chair of this session, co-chair, UNICEF country representative, my distinguished and respected psychiatrists, psychologists, senior doctors, and all the dignitaries who are involved in the prevention, promotion, treatment, care, support, and rehabilitation activities of mental health. And ladies and gentlemen, the Constitution of Nepal has established health as a fundamental right of the people. Mental health and as integral part of health is included as part of basic health services in national health sector. The vision of national health policy has also highlighted mental health along with physical, social, spiritual health to lead productive and quality lives. The recent Public Health Act has also included mental health services as a fundamental right should be included in basic health services and urged to government of Nepal to deliver these services in free of cost for all Nepalese people. The Disability Act has widely included mental health and psychosocial disability under the disability and has ensured the basic human rights of the people with the psychosocial disabilities. Mental health action plan has been incorporated in the multi-sectoral action plan of the prevention and control of NCD in 2014. The National Mental Health Policy was developed in 1997 with the commitment to improve the access to basic mental health, protect human rights of the people with mental illness, produce human resources on mental health, and reduce stigma associated with the mental illness. The National Mental Health Policy is in process of revision. The changing context and lesson learned during the last 22 years has been reflected in the proposed revision mental health policy, and this policy is based on the nation's global standards in the framework of right-based and recovery-oriented service provided in the community health facility. There has been progress in mental health during this last 22 years since the policy was adopted. The importance of mental health has been realized more than ever. The level of awareness of the community people, health workers, and even the policy level authorities has been improved. The number and varieties of human resources in the areas of mental health has increased. The number of hospitals providing services for mental health has been also increased. The increasing is also increasing. There is functional mental health unit under NCT and mental health section in coordination to coordinate the activities of mental health throughout the nation, and here the Ministry of Health and Population for number of inpatient beds allocated for the people with the mental health problems has been formulation of relevant legislation. The government of Nepal is preparing to develop a health system into new federal system. I think we are organizing this conference in the right time because now our unitary government system has changed to the federal structure, and all the rules, regulation, all the directives are going to change with the current to in line with the national constitution. So the finding from this conference will be the right document for us to incorporate our revising national health policy. We are just revising national health policy very soon, and also we are also developing different protocols, manuals, different guidelines, and different act rules and regulations related to the health services. So Ministry of Health will be very much grateful with this conference that we will have the adequate resources for the mental health activities to incorporate the mental health activities into our plan, policy, documents, guidelines. So I am very much delighted with this conference that Ministry of Health and Population will enrich with the discussion that we came to know that different international, national experts are here to discuss and the mental health related issue that will be the asset for the Ministry of Health and Population. So lastly, I congratulate all these organizers doing very hard work and all the distinguished delegates who has come from along to the different countries, and I also welcome here in this very important forum, and thank you very much.
Very encouraging words. We would like to make a very small change to the schedule and bring forward two presentations which we would like to take the opportunity to present in front of all the dignitaries that are here for the inauguration ceremony. Hence, I'd like to request Dr. Arun Rajkumar to present on child and adolescent mental health services in Nepal, the past, present, and future.
So I'm going to start with how we have all come here and history of child mental health in Nepal. So the child mental health concept was basically started in 1998 by one of the psychiatrists who came back, and Dr. C.C. Regmi. He started a child guidance clinic at Teaching Hospital in 1998. Dr. Saroj and me were his participants, resident at the time. And then same time around 2005 to 2012, CMC Nepal also started child guidance outreach clinic at the Dolkha. You know, the big question when I came back, everybody asked, do we really need child psychiatry? That was about 10 years ago. And I said, definitely, why not? I'll start with a question. When somebody asked me, is there autism in Nepal? And this was around 10 years ago. I said, there must be, but I haven't seen one. The same day, one of Dr. Maleko, I think she's an autism activist, she brought her son. And that day I saw him in my house and diagnosed the first case of autism. Now, every week, I see in average 5 to 7 new autism cases. So it's not that these things don't exist, it's just that we are not looking for it. So if you really look at the prevalence, worldwide data, 13 to 20% of the children suffer from some kind of mental health problems. Suicide is a leading cause of death, second leading cause of death worldwide, whereas in youth, suicide is the #1 cause of death in Nepal. In other countries, it's an accident, whereas in Nepal, we don't have that many road vehicle accidents compared to other countries. So this is a study. I'm going to quote some studies that will be presented in this seminar. And this is a study by Dr. Mohat, who is here. This is a study of 2,999 school children from 30 districts. They use CBCL teacher ratings. And they found that 14.74% of children had some kind of psychological disturbances. That was confirmed after the screening. So this is another study. This was conducted in 2018. I think this is the first time this has been presented in this seminar here. This is done by Kanal. So it included 1,545 grade 1 to 8 students from 50 government primary schools from Kailali and Salem district. They looked at different measures. They looked at scholastic backwardness was observed in 7.3% of the children. Emotional behavioral problem was observed in 17.2% of the children. So Dr. Jasmine Ma, who is one of our team members at Kanti Children's Hospital, is presently conducting a nationwide prevalence study of child and adolescent psychopathology, mainly looking at emotional and behavioral problems in school. She has already collected data on more than 4,000 children, and she is in a process of data mining. So once this study will come out, preliminary data suggests there is a significantly number of, more than 15-17% of the children have some emotional behavioral issues. And I think once this study is done, it will be a seminal study, not for Nepal, I think most of the third world country. So this is my personal experience. Last year, we were at Ilam district trying to train some healthcare workers on child mental health. Dr. Kedar, me, Dr. Pasupati, we were all there. And when we screened them, we found out that 23% of those have a chronic seizure and 11 have chronic psychosis. And we can imagine these young people who develop normally till seizure, and they have been identified in a community, which is a good thing. But so these people, if you would have treated them on time of mental health, so I think it's a definitely high time that this is just not one Ilam district. If you think about it, it's probably most of the rural Nepal, or even cities. Last year there was more than 5,300 suicides in Nepal. So that amounts to close to 26 per 100,000. And the leading cause of death in young people. Now if you really think about, come down to children in difficult circumstances like children in the street, children with special needs, child labor, child marriage, children who are being trafficked, victims of physical, sexual abuse, children from low socioeconomic status, even physically disabled. In a paper 2 years ago, there was this case from Baru district, a disabled girl who is 19-year-old, who cannot walk, has been pregnant twice. Do you think, the physical abuse, sexual abuse also exists? And especially the children who are mentally, physically handicapped are more vulnerable. So if you really take all these, special children who are in difficult circumstances, they have a lot more mental health issues than the general children. So this is a problem in Nepal. So in April 2015, we had a massive earthquake, which was a very unfortunate thing. Almost 10,000 people died. But if you really think about 5,000 people dying every year from suicide, we have earthquake every year. It's just that we are not looking into it. So after the earthquake, we had a massive awareness about mental health, and that led to the opening of this child and adolescent mental health clinic at Kanti Children's Hospital. So this was the garden where we slept for 2 weeks with my family after earthquake, because everyone was scared to go inside the house. So this is the scenario. In about 8 years, 10 years ago, in child guidance clinic, they have seen about 50 patients per year. Last year, we saw more than 2,200 new cases at the Kanti Children's Hospital. So this is the only child psychiatric clinic in the country. There are a lot of kids who have no access, there is no place to go, and they are left out in the community. So the problem definitely is there. So the cases we have seen are developmentally delayed, intellectual disability, children with CP, autism, speech delay, repeated fainting attack, mass hysteria, pseudo-seizure, epilepsy, school phobia, abdominal pain, children with insomnia, sleep problems, academic problems, behavioral problems, sexual abuse, children in orphanages, group homes, PTSD, adjustment disorder, mental retardation, intellectual disability with behavioral problems. There are children who have psychosis, schizophrenia, OCD, bipolar, chronic constipation, children who have feeding problems, night terror, sleepwalking, tics, Tourette's, trichotillomania, encephalitis. We see a lot of children, because we are at the Kanti Children's Hospital, we see a lot of referrals from oncology department. You know, the kids who have cancer, kids who have chronic renal failure, kids who have HIV, you know, those populations, nobody even talks about mental health issues. You know, it's a massive problem in there. So now I come briefly to touch about the stigma and child mental health. You know, stigma is a major issue, and this is a frequent response of the caregivers who come to our clinic. First and foremost, they are totally confused why they are referred to psychiatry. What they do is, they hide their children behind them, and they say, my child is not a psychiatry, but I don't know why they referred me here. There's a denial in caregivers. There's a denial, anger. They're really mad that the other pediatrician referred them to the psychiatrist. So, you know, there's a fear and mistrust, and it is culturally, it's for many years. So, you know, stigma has led to treatment gap, health-seeking delays, low treatment adherence, and one important thing I want to touch is kids who have mental health problems and developmental problems, schools are very, very biased towards them. The school who refuse to take children who have mental health problems, they are often suspended, discharged from the school. They are refusing to provide any kind of support. Especially this elitist school in Nepal, they only want to take children who are highly intelligent, smart, who are behaviorally well. Any problem with the kids, anything they have, they call in Nepal what they call rusticate, means they'll throw the kids out of the school. So it is a really difficult scenario for children who have mental health issues. There is a stigma in caregivers, health providers, doctors, nurses, pharmacists. You know, sometimes if I write a prescription and the patient will go and ask the pharmacist, what is this? Pharmacist will say, why are you taking psychiatric medicine? Stop it. And this person will come back to me and say, Dr. Saab, this pharmacist told me to stop medicine. And I'll tell him, so should you take advice from a pharmacist or a doctor? But that's a culture we have in Nepal. And it's a stigma that even a pharmacist or a nurse or even the other doctors, if my patient will go to some other doctor, they'll say, why are you taking psychiatric medicine? Or why are you taking psychiatric help? You don't need psychiatric help. So I think it's a fear. It's a worry that if you have mental health, you are doom and gloomed. That's not the scenario anymore. Any kind of mental health problem, you can treat and be a normal human being and live a normal life. And that's the message we want to give. So these are the basic services in Nepal right now. You know, we provide psychiatry evaluation, management, psychological evaluations. We do IQ testing, a lot of other psych testings, psychological services. We provide developmental evaluation. In fact, there are very few, I think we saw one of the developmental pediatricians yesterday. I was very happy to see him. So we have 2 or 3 developmental pediatricians, few neurologists. So there are a lot of kids who are developmentally delayed, intellectually delayed, who have autism. You know, we get bulk of our referral from them. And what do we do? Sometimes we do a lot. Sometimes we do diagnosis and nothing. I have a child. He's about 12-year-old. He's severely autistic. He hit his mother with a grandmother with an axe and in the head, and the grandmother almost died. Father comes to me, this child is tied like this, tell me where can I take him? So it's very difficult to say where, you know, the father cried. And unfortunately that child is still tied up. It may sound like a one parent, but there are a lot of children like that. I can show you that people will text me and say, can you do something about this child? I have a photo of a child. She has this wooden lock on her leg so that the mother can go work in a field and she won't wander around. It is hard and it is not easy. So, you know, when we think about children with disabilities, children who have severe mental health issues, developmental issues, it is difficult. So, but we hope this scenario will change. So coming back to Nepal and demographic, 42% of the children are under 18 years old. That amounts to almost 1 to 1.5 million children who are needing mental health services, who are totally ignored. So what does the government do? Government spends about 5% of GDP. This year it has come down to 4% in fact. And out of that 4%, they spend less than 1% on mental health and almost zero in child and adolescent mental health. But with our senior members from the Ministry of Health, we are very hopeful this scenario will change soon. So we have now 2 child psychiatrists. Till about a month ago, I used to say I'm the only child psychiatrist. Now I'm not the only child psychiatrist. We have one other psychiatrist who got trained in NIMANS with the help of Dr. Sekhar and Government of India. He's back here. We have one other psychiatrist who's getting trained in India. We have had 4 psychologists who had 3 month to 6 month training at NIMANS, Department of Child Psychiatry. So there are very few people, allied health professionals, who really work with children. There are very few neurologists. I told you there are only 2 or 3 developmental pediatricians, few psychologists, social workers. Being admitted to an adult psychiatry unit. So there's a need for development of inpatient service and other treatment centers. And I think ultimately, it's important to develop some kind of center of excellence where we can provide training, and ultimately we need to produce more mental health professionals who will work with children. It is not possible to solve all Nepal with 1 or 2 or 3 people. So I think developing some kind of training facility where we can train more child psychiatrists, child psychologists, social workers, special education teachers, occupational therapists, and other allied health professionals. Third is IQ testing for Nepal. So there is a lot need to be done and developed with our own research in child and adult psychiatry. So this is a building, hopefully we'll be building in Kanti Children's Hospital. So we have Government of Nepal Kanti Children's Hospital and Ministry of Health and us have a MOU signed. And we are soon going to dig in this plot. The government gave us 2 ropni of land, which is a big thing in Kanti Children's Hospital. So I have enough money to build the ground floor. So we are looking for 2nd, 3rd, 4th. So the big thing is, just developing a center where people can come in, that's also centrally located in Nepal, is not enough. I think if you really think about people who are in the community, people who are in Rukum, Rolpa, Janakpur, those people we will never be able to access. There will be never enough child psychiatrists in Nepal. There are about 7 child psychiatrists in the USA and they have 20,000 job openings. So in Nepal, in next 50 or 100 years, we'll have never enough people, specialized people. So it's important to develop parallel community mental health programs, community mental health preventive work, so that we can take mental health to the primary care level. So in fact, with UNICEF, we are trying to develop a training manual to train community health workers, HA, CMA, on awareness, identifying the behavior, emotional, and other mental health issues in children. The big problem is just awareness and identifying is not enough. Where will they refer them? If we do too many awareness, sometimes I wake up in the middle of night and think, oh my God, if I really get like 10,000 referrals, what will it do? Right? There's nothing to do. So we are also envisioning a mid-level training where we want to train GPs, pediatricians, psychiatrists, mid-level community workers so that they can refer to the mid-level. And finally, if that doesn't work, then they can come to the central level. So I think this community work is very, very important, and so we are trying to develop that too. So the challenges in mental health is, biggest thing is lack of awareness. This is like a preaching to a choir. All of you are here because you value mental health in children. But when you go back, please talk to at least your friends, family, someone you know in a community that this problem exists. We need to be aware. Lack of manpower, which I already talked about, and the government involvement or lack of it. This is the biggest day for child and adolescent mental health, that government has taken this initiative to do this conference. I think we have already started this step, so I'm really hopeful that our government will step in and start doing something in child mental health. And we already talked about lack of infrastructure, funding. So I'm going to talk briefly on child and adolescent mental health policy. So we have adult mental health policy, or now what is called National Mental Health Policy, which is being finalized for 20 times but never implemented. Now we are also working on a Mental Health Act that has been discussed 20 times and now finally is gone to the Health Act. But it's okay, no matter where the act will get. If the act will get passed by a parliament and will be implemented, we'll be happy. The most important thing I like to highlight, especially our government delegates here, total percent of the population is almost more than 40% are less than 18-year-old. When you design or outline a budget line, you have to proportionately give money, allocate budget for these programs. It's like a chicken and egg story. They say you have no program, we don't have budget. There's no budget, there's no program. So when we pass this Mental Health Act, and if we can get and clearly write in the act that any budget that is spent on mental health by a government of Nepal, 40% of that should be spent on child and adolescent mental health. If we can do that, we can make a difference. So now the final slide, constitutional provisions that are directly related to the children. Article 31 says, every citizen shall have the right to access basic education. Do you want to come to my clinic every day and see how many kids can't go to school? Because no school will take them. There is no special education in Nepal. If you are intellectually normal and doing well, if you don't have behavioral problems, emotional problems, you cannot go to school. So, Article 35, every citizen shall have the right to free basic health services from the state, and no one shall be deprived of emergency health services. I'm hoping this is coming. It's in our constitution. Article 39, every child shall have a right to name and birth registration. Every child shall have the right to education, health, maintenance, proper care, sports, entertainment, overall personality development from the family and state. How many of you think this is really being implemented? But it's in the article of Constitution. I'm hopeful that we will take this to the heart and implement it in the coming days. So, this is a picture from my same garden after the earthquake. So the picture is hazy. My twin girls had a birthday that day and we were cutting cake. And I was taking a picture and it was aftershock. And that's why this picture is hazy. I love this picture. It brings a lot of hope. You know, we went through this massive earthquake. We all thought we were going to die. We were running away, not getting into the house. Now we have all recovered and we are here. I'm hoping, you know, we have this resiliency and this thing that we all can do. And we can make a difference. And thank you all for being here. I especially thank government, UNICEF for being part of this, and thank you all.
this opportunity to acknowledge the organizations that have made this day possible. The supporting partners and organizing committee members. I just mentioned the organization names here. With another presentation, I now invite Dr. Meghnath Dhimal, Research Officer at Nepal Health Research Council, to present the findings of National Mental Health Survey, a initial pilot study.
As well as myself, I would like to welcome you all in my presentations. And first of all, I would like to thank the organizing committee for accepting our request to share the findings of this pilot study even in the last hour, because we just requested this week and they accepted our request. With support of WHO and Government of Nepal is working on National Mental Health Survey. So these are the findings of this pilot study, and we cannot definitely generalize in the overall population. So some of the findings may be quite contrasting with the existing study. And we have a team here. Professor Anjani Jha is not here, but Professor Saroj Udasar, I am just looking, and Sushmaji and Shweta. So if there are any questions later, our colleagues will definitely contribute in discussions. And in the previous session also, Dr. Kuwar already mentioned the situation of the mental health in Nepal, especially among the children. And actually the mental health problem itself is a global public health problem. And overall mental health and substance use disorder ranks 5th leading disorder category in terms of disability adjusted life years. And global burden of mental illness accounts for 32.4% of years life with disability yearly, and 10.3% of disability adjusted life years daily. So, but most of the studies are conducted in the development, especially in Europe and America. But the evidence from the developing country is just emerging. And definitely there are difficulty in conceptualizing and measuring the mental disorders, which is another challenge, because most of the tools developed so far are from the development. And now we have to adopt them, or we have to develop our own tools. And if you see the Nepalese people's volunteer to the mental disorders, basically we can, that we most of the papers cite like 10 years long armed conflict and political unrest, devastating earthquake of 2015, mega earthquake, high employment rate, etc. However, there are one small scale study done in the different parts of Nepal which indicates an increasing prevalence of mental disorder, like Dr. Kuwar said already. In this context, Nepal Health Research Council is conducting a National Mental Health Survey of mental disorder in Nepal in collaboration with Ministry of Health and Population and WHO. I just want to share the major activities performed so far now. Actually, we formed the high-level steering committee chaired by then Chief of the Curative Division and now Chief of the Health Coordination Division, Mohinder sir. And also the technical working group of 19 members representing from WHO, government, like from EDCD, Dr. Borali is also there, from TPU and others, from academia, and Dr. Saroj is also in some steering committee. And we have international advisor, Professor David Sna, who is the owners of the mini tools, and also Professor Dr. Gopal Krishna Gururaj, who lead the Mental Health Survey of India. And we performed the translation of mini tools into Nepali language. And we provided the training to our team members with the support of Professor David by Zoom webinar. And we have already completed the pre-testing and piloting in 3 districts, Dolakha from the mountain, Bhaktapur from hill, and Dhanusa from Tarai. And the objective of our pilot study was to assess the prevalence of mental disorder, basically which is very important to determine our national survey sample size. And next, to assess the pathways of treatment of mental disorders, to identify barriers of treatment for mental disorders, to assess the feasibility for the National Mental Health Survey in terms of time, resource, costing, etc. To refine the tools to be used in the National Mental Health Survey if any change is required. And finally, to estimate the time, cost, and human resources required for the national mental mission. Our study design was the quantitative descriptive cross-sectional study. Like I said before, our study sites were 3 purposely selected districts: Dhanusa, Bhaktapur, and Dolakha. Our study population was adults in age 13 to 17 years. Actually, we adopted from the Indian Mental Health Survey because they have used 12 to 16 years, 13 to 16 years, and we use 13 to 17 years. And adults is 18 years and above. That means we have included both adolescent as well as adults. And total sample size was 1647, which includes 1371 adults and 276 adolescents. And sampling was probability proportionality size method was applied to identify households at ward levels. We used the mini international neuropsychiatric interviewed adult and mini kid version 7.0.2. And we also used the barriers to accessing care evaluation based tool, also pathway related questionnaires. And we did the additional disorders such as epilepsy, dissociative conversion disorder, and intellectual disability were also assessed. And we used the techniques face-to-face interview using the questionnaires. Translation of the tools. Actually, we did the Mini tool. Mini tool is an internationally validated tool to assess the mental disorder. That's why we adopted this after through rigorous discussion, because we also thought using the CD tools, Mini tools, and other tools. But finally, our both steering committee and technical working group concluded that we come in consensus to use the Mini tools. However, since it was not translated into Nepali language, means first time using Nepal, NHRC worked with a team of experts and the owner of the tool, Professor David Snap, to translate and guide this tool into Nepali language. So these are the steps we followed for the translation using following the different evidences from the literature, like translation of English tool in Nepali language by a bilingual speaker, and then review of the translation version by a group of mental health experts. Then evaluation of translated item by face-to-face interview with the prospective research participants, and blind back translation by those unfamiliar with the original version of the questions, and verification of translation Nepali and blind back translation by a team of experts, and finally revision and necessary modification was done. We took the ethical approval from the Independent Ethical Review Board of the Nepal Health Research Councils, and we took the written informed consent from the adults participant, whereas for adolescents, accents from whom was used, that was duly signed by their guardian or parents. For adverse event management protocol was used to take appropriate actions during the process of data collections. Like the protocol was used if any individual with a suicidal tendency or severe form of mental disorder were found and needed a referral for mental health facility or service. These are our findings of the pilot study. Like the socio-demographic profile, 62.7% were females, and 88% were Hindu, and 58% people have the nuclear family, and the average age was 17 years. These are just findings of adolescents. And regarding major disorder, current prevalence of any form of mental disorder was 11.2%. And in our study, we do not rule out the autisms. So if we include the autism cases also, then it comes around 15%. Specifically, major depressive disorder was 0.7%, suicidality was 8.7%, panic disorder was 0.4%, agoraphobia 2.2%, separation anxiety disorder was 0.4%, specific phobia was 1.1%, and finally, obsessive compulsive disorder was 1.1%. And of the total participants, 1.8% had taken any substance in the past 12 months, but substance use disorder was present among 0.7% only. And 12% participants felt that they had less intellectual capacity than other children of their age. And I have just shared also the finding of adults just in a single slide. Among adult participants 18 years or above, 13.2% currently had any form of mental disorders. That was like major depressive disorder was 3.4%, suicidality was 10.9%, psychiatric disorder was 1.1%, alcohol use disorder was 3.2%, whereas 5.2% had 3 or more alcoholic drink within 3 hours period. And substance use disorder was among 7.3%. whereas 13.9% had non-alcoholic substance use. And general anxiety disorder was among 1.4%. And dissociative identity disorder was among 1.5%. So if you compare between the adolescent and adults, like by sex, like among the male and female, in adolescent it seems that higher prevalence among the females. But in case of adults, it seems higher among the male, like 21.8%. Among male, that means. And that is just the raw percentage. Like if you see the marital status, that means definitely higher among the adolescent married persons, like 16.7%. And if you see the adult, that means highest is seen in the widow group, that is 29%. And if you see the family type, in the both groups, there is a higher prevalence of mental disorder among the people who live in the nuclear family. So regarding finding related to a pathway of care and base, asked to adult person only which revealed that among those with any form of mental disorder, and only 18.7% revealed the treatment in the last 12 months. And the major barrier in accessing and receiving the care was related to the attitudinal barriers. Like for example, about 77.6% of the participants who did not receive treatment did so because they wanted to solve their problems on their own, followed by feeling embarrassed to share that they have mental disorders. In conclusions, the pilot study helped us in getting some insight into the situation of mental disorders in Nepal, and the estimates are being used to calculate the sample size for national level survey. Currently, actually, we are working, and our estimated sample is around 12,000, but still we are working on that. And testing and revising the tools, it helps a lot to test for this, and preparing a list of local terminology for some terms in equation, because we have a very high ethnic diversity. So there are the local terminology in the hill, mountain, tara, among different groups. So we identify some common terminology, and that we have listed and that we have replaced with the original terms, so that detection will be quite high later. And that means exact detection. And it also helped to enhance the capacity of the research team, because it took almost 1 year to complete the translation of these tools in Nepali, as well as completing the pilot study. But that also helps to enhance our capacity to proceed ahead for the National Mental Health Survey. And I did to 21 November for training to our team member as well as the data collectors. So to develop the sampling frame, and we are planning to start the. I must acknowledge to our district committee members with the name of this is quite long, so I'll just spell out what it includes all of the tools translation, practice interview, and thematic group meetings, and training of moderators. References. And thank you so much. And queries are highly welcome. And I also request my colleagues to contribute with any very technical questions. Thank you.
स्वास्थ्य तथा जनसङ्ख्या मन्त्रालय गुणस्तर मापन तथा नियमन महाशाखाका निर्देशकज्यूको उपस्थिति रहेको छ। डाक्टर दिपेन्द्र रामन। Upcoming 2 days, I would now like to request Dr. Vivek Kumar Lal also announce the closure of the inauguration session. Meanwhile,
Division, Minister of Health and Population, Mr. Mahendra Prasad Shrestha, Country Representative of UNICEF, Mr. Tomo Hozumi, the co-chair of this conference organizing committee, Dr. Arunraj Kuar, directors and division chiefs of respective divisions and centers under the Ministry of Health and Population, and the Department of Health Services, representatives from different line ministries, including the Ministry of Women, Child and Senior Citizen, Ministry of Education, Science and Technology, Ministry of Youth and Sports, National Human Rights Commission, National Women Commission, National Health Research Council, various professional councils, mental hospital, heads of the Department of Psychiatry and Psychology of various institutes and medical colleges, professionals, delegates and experts from various countries including Norway, United Kingdom, Canada, USA, India and Nepal, heads and representatives of several international and national non-governmental organizations, academic institutions, hospitals, media personnel and all the participants of this conference. I'm honored to be present here as the chair of the first International Conference on Child and Adolescent Mental Health in Nepal. It's my pleasure and privilege to welcome all the international and national delegates and participants to this conference. The conference brings government, national and international agencies, health professionals, social workers, academia and research institutions together for promotion of child and adolescent mental health in Nepal. As highlighted so well by the chief guest as well as other distinguished guests and experts, we are pleased to share some remarkable progress made in the field of mental health in Nepal with you. The organization of International Mental Health Conference in the February 2018 as well as this conference on child and adolescent mental health demonstrates the commitment of Government of Nepal for promotion and development of mental health in the country. We committed to address the mental health needs as recommended by the declaration of these conferences. Many of the dignitaries, including Honorable Minister of State, Minister of Health and Population, Secretary of Minister of Health and Population, Health Advisor to Honorable Deputy Prime Minister, as well as the Director General of Department of Health Services, and several other senior officials who had kindly consented to grace our conference today could unfortunately not be present today as they had to be in Dhanbadi in the province, in the Sudur Paschim province today. As you all know, there is a national health review being conducted there, but they have expressed their support and have sent their best wishes for the success of this conference. And rest assured, we'll share all the proceedings of these 2 days conference with them for their support in the development of relevant policies and plans in the future. And I would like to express this opportunity to, I would like to take this opportunity to express my gratitude to the chief guest, Director Coordination Division of MHP, for his valuable presence in the opening ceremony. I know he has a very important commitment that he has to attend to, but still he could find time for that, as well as the country representative of UNICEF, Mr. Tomo Hozumi, for his very elaborate and extensive speech, as well as for his presence. And also, I'm equally grateful to the directors and division chiefs of the divisions and centers with the Ministry of Health, all the representatives from other line ministries, as well as the different commissions, councils, professional bodies, academia, various institutes, medical colleges, the professionals, delegates, and the experts from different countries for their presence as well as for the active participation. On behalf of the Conference Organizing Committee and Government of Nepal, I would like to express my sincere thanks to all the supporting organization, the organizing committee members and subcommittee members for their tireless effort in the organization of this event, and as well as for their dedication. And with this, I would like to announce that the opening session comes to a conclusion, and I'd also like to invite you all for a cup of coffee or tea which is waiting outside. Thank you very much.